Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning to all of you, ladies and gentlemen. Welcome back to my channel. Today we are so glad because we are going to continue our discussion about occupational safety and health application in the pharmaceutical industry, especially the working inside the Department of Pharmacy. Okay, together with me today is Puan Mazdila. Assalamualaikum Puan Mazdila. How are you today?
Waalaikumsalam. I'm fine, thank you.
Alright, and then together also with me is Puan Azlina. Puan Azlina, Assalamualaikum Puan, okay ke? Can you hear our voice over there, over here? Okay, alright. And then we have our speaker today, Mr. Muhammad Faiz bin Jaafar. Assalamualaikum Cik Faiz, how are you?
Waalaikumsalam. Alhamdulillah.
Alhamdulillah. Sobahul khair, sobahul nur. Alhamdulillah. Alright, so without further ado, I would like to invite Mr. Muhammad Faiz. But before that, for the information of the students who are attending this seminar, please make sure that you attend and watch this video. Because towards the end, we are going to record your attendance and also noted your participation inside these activities. So make sure that you are able to view this YouTube channel via Telegram, and also please insert your relevant assignment inside the iBest system. Okay, so let me invite our speaker for today, Mr. Muhammad Faiz, to deliver his presentation. Silakan Mr. Muhammad Faiz, the floor is yours.
Okay, Assalamualaikum dan selamat pagi. Saya Muhammad Faiez bin Jaafar. So, pagi ini saya akan present mengenai health risk assessment yang mana saya pilih salah satu ubat hazardous agent drug, iaitu saya ambil oxaliplatin. So ini adalah safety data sheet oxaliplatin saya ambil daripada company. So produk material name ialah oxaliplatin injection. Dia dalam bentuk soluble. So dia punya trade name dia not established. Chemical family dia pun not determined. So dia punya intended use adalah untuk anti-neoplastic, iaitu untuk ubat untuk kanser lah. As an identification, classification of the substance or mixture, dia punya klasifikasi dia adalah germ cell mutagenicity, iaitu jenis kategori 1B. Dia punya reproductive toxicity pun sama juga, kategori 1B. So dekat label element, signal word adalah danger. Hazard statement, dia boleh menyebabkan may damage the unborn child and may cause genetic defect. So hazard identification, dia punya precaution statement. Ini ada dia punya special instruction sebelum kita guna. Yang pertama, kita perlu memakai PPE as required. Yang kedua, jika terdedah kepada ubat ni, get the medical attention. Ubat ini perlu disimpan dalam almari yang berkunci. For the dispose of the content or container in accordance with all local and national regulation. This is the composition of oxaliplatin, iaitu dia punya ingredient. So ingredient dalam oxaliplatin, yang pertama kita ada raw material dia, iaitu oxaliplatin. Yang kedua kita ada sodium hydroxide, tartaric acid and water for injection. Ini adalah first aid measure jika kita terdedah kepada ubat ni melalui eye contact. So apa yang perlu kita buat adalah flush with water while holding eyelid open for at least 15 minutes. Okay, jika kita terkena kepada kulit, remove contaminated clothing, flush area with large amount of water. Seterusnya gunakan sabun. Dan kalau for the injection, never give anything by mouth to an unconscious person. Wash out mouth with water. Do not induce vomiting unless directed by medical personnel. So jika kita inhale, inhale, remove to fresh air and keep patient at rest. fighting measure, extinguisher media, kita boleh guna extinguish fire with carbon dioxide ataupun extinguisher powder, foam or water. So special hazard arising from the substance or mixture, hazard combustion product, formation dia akan membentuk satu toxic gas jika terdedah kepada panas ataupun or fire. Dalam accidental release measure. So personal precaution, protective equipment and emergency procedure. Personnel involved in cleanup should wear appropriate personal protective equipment. So environmental precaution, place waste in an appropriately labeled sealed container for disposal. Care should be taken to avoid environmental release. Okay, handling and storage ni bukan hanya untuk oxaliplatin sahaja sebenarnya. Yang ni pun sama je dengan ubat-ubat cytotoxic yang lain. Jika kita precaution untuk for the safe handling, yang pertama, avoid breathing vapor or mist, avoid contact with eyes, skin and clothing. When handling, use appropriate PPE, wash your hand and any exposed skin after removal of PPE. Release to the environment should be avoided. Review and implement appropriate technical and procedural wastewater and waste disposal measure to prevent occupational exposure or environmental release. And the last one, potential point of process emission of this material to the atmosphere should be controlled with dust collector, HEPA filtration system or other equivalent control. Okay, dia punya stability and reactivity. Okay, dia punya reactivity, no data available. Chemical stability, dia stable under normal condition. So maksudnya dalam room temperature. So possibility of hazardous reaction, dia punya oxidizing property, no data. Condition to avoid fine particles such as mist. Incompatibility material as a precaution measure, keep away from strong oxidizer. So the hazardous decompose, no data available. Okay, ni adalah dia punya disposal consideration waste treatment method. Yang ni pun sama juga, mana-mana ubat cytotoxic biasanya sama je macam mana kita nak dispose. Okay, dispose of waste is adalah according with all applicable law and regulation, depends on the national regulation. Member state specific and community specific provision must be considered, considering the relevant known environmental and human health hazard of the material. Review and implement appropriate technical and procedure wastewater and waste disposal measure to prevent occupational exposure and environmental release. So benda-benda ni semua saya ambil daripada sheet daripada company Pfizer. It is recommended that waste minimization be practiced. The best available technology should be utilized to prevent environmental release. This may include destructive technique for waste and wastewater. Nak form lah. So hierarch form ni saya buat dekat HTJ dan saya bukan buat sendiri lah. Hazard yang saya dapat menyediakan ataupun work activity adalah kita menyediakan atau rekonstitusi ubat cytotoxic. So hazard saya terdedah kepada cytotoxic which can cause penyakit. So existing risk control, kita perlu pakai PPE ataupun melakukan medical check-up lah secara berkala ataupun 3 bulan sekali. Likelihood 4, severity 1, risk 4. So recommended control measure, kita perlu apa yang perlu kita buat adalah penggiliran kerja. So maksudnya bukan hari-hari lah kita perlu masuk, kita perlu ada jadual penggiliran. Okay, yang kedua, menguruskan stok ubat cytotoxic. Okay, kadang-kadang ubat cytotoxic ni stok kita sangat sempit dan kita perlu susun ubat tinggi lah. So dia pun ada kita perlu tambahkan kabinet baru ataupun besarkan dia punya ruang kerja ataupun store tu tersebut. Likelihood 1, severity 2, risk 2. So recommended control measure mengekalkan kawalan risiko sedia ada. Okay, thank you. Sir?
Please continue. Please continue. Yeah, we can hear you. No problem. Yeah.
So yang seterusnya saya akan present mengenai poster saya. Okay, ini adalah saya punya poster microbiological on manual handling. Dia punya BSc. 70% of air is recollect and 30% of the HEPA filter air is exhausted either back to the lab or to the outside atmosphere. So dia punya root problem adalah unclean and inaccessible. So dia punya hazard dia akan menyebabkan kontaminasi and microbe growth. Atau mitigation measure, kita perlu guna passboard atau hashboard for any material transfer. Yang kedua, clean any spillage on the floor. Yang kedua saya ambil adalah PPE. Problem dia adalah hazardous material. Hazard dia health safety. Mitigation measure, wear suitable PPE, chemo assistant, glove, not slippery bottle, safety goggle. So seterusnya adalah floor. Masalah dia adalah slippery or uneven surface can cause contamination and microbe growth. Contaminated mitigation measures, smooth, not slippery and even floor design. So, problem boleh menyebabkan microbe contaminated due to ideal temperature depends on type of microbe. Mitigation measure standard temperature is 19 until 21 darjah Celsius, not exceed 23. Yang seterusnya ini adalah aktiviti 1, handling of hazardous agent. Plasma causing infection. 3 major kategori yang menyebabkan infection. Yang pertama kita ada bakteria, yang kedua virus, yang ketiga adalah fungi. Ini adalah dia punya mekanisme of transmission, method of transmission. Kita ada 3 juga. Transmission, yang kedua indirect transmission, yang ketiga satu mekanisme ke mana ia merebak. Okay, kalau direct transmission, dia indirect transfer of microorganisms to person melalui touching, beating, sneezing, coughing, spitting, singing or talking can project droplet spray into the conjunctiva. Direct transmission, ni dia soil clothes and utensil and surgical instrument or dressing can act as vehicle. So that's why kita dekat bilik bersih, faucet ke tray yang mana kita nak guna dalam clean room, kita perlu hantar untuk sterilization sebelum kita masuk clean room. Any act to avoid infection. So sebelum kita masuk clean room, kita akan, yang pertama kita akan wash our hand menggunakan 7 soap and warm water for at least 20 second. Lepas tu kita akan gunakan use alcohol hand gel or sanitizer. For environmental hygiene, kita perlu clean contaminated surface with commercial germicide cleanser or wipe. So biasanya sebelum kita memulakan kerja, kita akan lap semua surface yang contaminated, termasuklah passboard, sinki dan sebagainya. Yang kita gunakan iaitu aseptic technique. Okay, this technique kita gunakan adalah untuk mengurangkan the possibility of transferring microorganisma from one place to another. Method of transmission melalui airborne transmission. Okay, airborne transmission ni may involve droplet or dust droplet nuclei, the residue of evaporated droplet emitted by an infected host, dust particle containing the infectious. Okay, ini adalah cara-cara macam mana kita nak mengatasi masalah. Employer should provide yang pertama hand washing facility, yang kedua tissues, and yang ketiga cans for disposing of tissue. Okay, yang tadi should follow. Avoid close contact with people who are sick. Maksudnya siapa yang nak masuk pada hari itu, siapa yang nak kena masuk clean room ke apa untuk buat persediaan. Yang pertama dia perlu elakkan close contact with people who are sick. Jika kita sakit, kita perlu duduk di rumah dan stay at home when sick. Yang ketiga, cover your mouth ataupun nose with tissue when coughing or sneezing. Nose, mouth or eyes. Wash your hand often with soap or water or alcohol. Sama je lah macam tadi. Okay, that's all sir. Thank you. Saya ni betul ke tak sir?
Pardon? What is that?
Saya tak tahu slide saya ni menepati apa yang saya nak.
Okay, nanti kita akan discuss sekejap lagi lah. Alright. So thank you very much Mr. Faiz for your presentation. So the first comment, I would like to honor my friend Puan Azlina to comment with regard to your presentation. Silakan Puan Azlina. Any comment for Mr. Faiz? Hello, Puan Azlina. Okay, kita ada masalah teknikal sikit dengan connection daripada Puan Azlina. Tak apa. Nanti kalau beliau available boleh teruskan. Baik, saya akan tanya beberapa soalan kepada Encik Faiz.
Okay.
Okay, soalan pertama adalah berkisar mengenai anda punya poster. So when we look into your poster, it is actually talking about microbiological on manual handling. So this specific poster is actually talking about preventions of the contaminated workspaces, or talking about the microbiological that can impact the human health. Which one actually this poster is talking about?
Okay, yang saya punya poster tu microorganisma yang akan impact dia punya environment.
The microorganisms that can impact the environment. So that's mean the microorganism will impact also the human health or not? You are talking about microorganisms that can impact to human health lah.
Yang saya buat tu tak sir.
So yang you buat ni adalah how the human life can impact the product of your creation. Correct or not? So that one is actually need to be reconstitute and also reorganized back lah, because it is not correct lah. Because usually when we talk about occupational safety and health, we are talking about the health of the people. We are not talking about the health and also the benefit of the product and so on. That one is a different story actually. But totally from your explanations and all the usage here, I can find out that all the material explained in your poster is focusing more towards the microbiological agent that can be damaged or that can be hampered due to the effects of the human activities lah. By right, you must talking about how this microbiological agent can impact human health via airborne or via droplet or via
Okay.
nuclei, whatever. How this agent, microbiological agent kan, because
Okay.
if you have a biosafety cabinet, for example, and then that biosafety cabinet is not well maintained by the people or qualified personnel such as industrial hygiene technician 2, and then it will impact the performance of the suctions towards the HEPA filter areas and so on, and then it will dissipate inside the indoor environment in your laboratory. So that is what we are trying to listen and heard about this explanation. However, it is need to be adjusted accordingly lah. For me, it is not very correct lah to explain about the product because we need to focus on the health
Okay.
of the occupant. Okay, itu yang pertama faham Mr. Faiz?
Okay.
Can you
Faham, Cik.
change on that? Because we are required you to make changes, okay? After finish up all the presentation and details, and then based on this comment, you have to do correction. It's either minor or major. It depends on the comment lah of the
Okay.
examiner.
Baik, sir.
Okay. So Puan Azlina, are you okay now? Or I need to continue with the second question from my counterpart? Ya, silakan Puan Azlina.
Cik Aizat.
You can put the chat over there so I can speak it up on behalf of you to the candidate. You can just type it inside the chat so I can read it up for you as a plan B. Silakan Puan Azlina. Okay, while waiting my colleague over there to prepare the questions, let me ask you about the high rank Mr. Faiz Boleh dengar Mr. Faiz?
Boleh.
Okay, so your high rank is actually focusing on the activities with regard to the dispensing or a reconstitution of the drug, which is involving the work unit named as the pharmacist lah, betul tak Awak pun tadi you are talking about this oxablendin, apa nama? Oxaliplatin. So oxaliplatin is one of the cytotoxic drug that can be used for treating cancer patients, especially what kind of diseases involved with this oxaliplatin Dia cancer apa
Breast cancer.
Breast cancer. Okay. So when you talk about this hazardous drug, you must make sure and you understand about the exposure, duration and magnitude. Yang itu you kena cerita lah. Semalam saya dah komen. Yesterday I already comment about this specific idea. So perhaps you also can utilize that idea lah in your SDS punya activities. Itu yang pertama. Tadi pasal poster. Yang kedua. Yang ketiga ni, under your high rank form, you are talking about the management of the stock inside the storage facilities ataupun storage area So your hazard is actually you tulis kat sini kedudukan ubat stok tinggi So hazard ni for your information lah, daripada semalam pun saya perasan ada student yang cerita pasal hazard ni. There are a lot of students that are slightly need to be adjusted lah their understanding hazard to be well defined nak paling senang faham hazard. Apa yang awak faham Faiz? Saya tanya dulu lah. What is hazard? Yeah.
Okay, apa yang saya faham
hazard in a sentence. Ya, silakan.
Okay. Hazard, apa yang saya faham ni, hazard adalah salah satu sesuatu benda yang macam yang boleh menyebabkan satu memberi impact yang positif negatif kepada kita. Maksudnya
Alright, so that is a definite, very good, well explained and easy to understand statement. So that one is correct. Anything that can cause harm to human is called hazard. Okay. So when you look back in your hazard identification, your pengurusan stok ubat cytotoxic, your hazard is kedudukan stok ubat tinggi. Do you think that one is correct or not correct? What is the hazard actually bila ubat tu tinggi?
Takut dia terjatuh kat kita.
Yes, that is the hazard. Anything that can cause harm to human. When the positions of the drug is on the high on the higher level, it is not a hazard. It is only a danger, a relative exposure towards that condition. But when the drug is falling down to the human faces, that one yang
That
kita
is
kata dia punya hazard, betul tak? Ataupun orang yang nak ambil tu terjatuh. There are some sort of working at height procedure, and then these people can slip over, tripling, and then falling down from the stairs. Itulah dia punya hazard. Dia boleh menyebabkan fracture and so on. Itu dia punya outcome. So remember, Faiz and all the candidate inside the pharmaceutical punya application ni, you must really understand what is the differences between the hazard, risk and danger. Yang you punya understanding dah betul. You faham anything that can cause harm to human is called hazard. That is super. Itu bagus, Faiz, Tanya. Cuma when you put it inside your documentation, it is need to be specified what kind of hazard that you are perceived. Okay, kalau you tengok kat sini kan, you kata kedudukan stok ubat tinggi. Kedudukan stok ubat tinggi itu is actually a danger. Itu danger, a relative exposure to the hazard. In fact, the hazard is actually something that can cause harm. What is the things that can cause harm in this issue? What is the harming condition that we are talking about? We are talking about the harming conditions of falling down. We are talking about the harming condition where the medicine falling down. So it depends lah. It's either you're talking about the human falling down from the stairs, or the material that the human trying to reach is falling down. Okay, that is need to be cleared, Mr. Faiz. Boleh, Faiz?
Boleh.
Okay, and then another one is the existing control measures is actually adding up more rack. I don't think this one is the existing control measures. You must remember, existing control measures is talking about how the conditions is being reduced significantly in order to reduce the risk. The risk is the likelihood and severity. What is the severity of falling down from reaching a box of medicine, for example? Fractured, what is the most severe that you can imagine of, for example? I tanya you, Faiz.
Okay.
Apa yang paling dahsyat lah orang boleh dapat ni bila dia ambil barang dekat tempat tinggi ni? Contoh.
Okay, paling dahsyat dengan kabinet tu sekali jatuh kat atas dia.
Dia boleh jatuh atas dia. Kabinet tu boleh jatuh dekat atas dia. Okay, so maksudnya sekarang paling senang lah saya nak bagi awak contoh. I just want to give you some idea about this thing. The simplest example will be the rack is not properly positioned. By right, the rack need to be arrested on the wall so that it won't be like that. So that one is on one part now. It's engineering design need to be make sure that the only that will fall down is the medicine or the product, not the rack. If the rack also falling down, that means your investigation is not deep. You need to justify lah all this. So this is the skill that we are trying to teach you. We are trying to make you understand. If you're trying to look into the risk assessment process, this is how you want to observe and quantify. Even you cannot quantify it in numerical values, at least you can perceptively think that these values should be higher due to the fact of this. These things should be lower due to the fact of this. Okay, you tengok kat sini you letak severity is 2. I nak tanya, you punya rack tu is bolted on the wall or not bolted on the wall?
Not bolted on the wall.
Not bolted on the wall, and then you give 2. Give 2 ni maksudnya apa? Dia datang ni dapat scratch je. Number 2 severity is talking about scratch. A first aider punya condition is no fracture, nothing. If rack is fall on you, you think you got fracture or not? Yes, you got fracture. So that's why the severity will be high. And then furthermore, is there any record that can back in up whatever that you explained just now? For example, the severity you letak 2 ni, ada tak apa-apa evidence lah yang kata 2 ni? Ke ataupun you just perceptively think that it is number 2?
I respectively think.
So you just macam perception you rasa dia 2. Okay, never mind. Whatever it is, that is what I'm trying to share with you, the idea of risk assessment. You have to look into those details. Even though your simplest task is just to identify the risk and then make a risk analysis and then look into the risk control. So when you look into the risk analysis, it need to be go deep, not shallow, or not just I think the best way to do is adding up more rec. It is not correct because you adding up more rec means that you adding up more risk because the current rec is not bolted on the wall. Faham tak maksud saya, Faiz? Awak punya existing measure ni tambah lagi rak tu tadi akan menambahkan lagi possibility of the injury to become not only number 3 but number 4. It's even death. Example lah. So this kind of thing you have to practice. It's okay. This is the first time for you to expose in the risk assessment process. We hope that you already learn something from this process and make correction so that you know when you go back to your facilities, when you make a risk assessment, a simple risk assessment, even though you are not specialized in this field, at least you know there is a likelihood involved, there is a severity involved. Sama macam you punya oxyplatin tadi tu, you punya hazardous drug, you have the element of hazardous drug tu punya nature. Tadi you cakap dia adalah not suspected tapi confirm. Dia suspected or confirm mutagenicity? Dia confirm ke suspected mutagenicity? Dia kategori 1A? Confirm. So kalau confirm, so that means the hazard rating is 5. Maknanya dia very, very hazardous lah. It is not good for us to be exposed with. Even though it is being spilled and so on, it is a very huge issue that need to be managed. So the next one that we can control, sebab dia punya nilai risiko tu dah 5 kan. So nak tak nak kita kena control dia punya act apa? Act apa, Faiz? Ini macam kita belajar kat sekolah. Okay. Expo apa?
Control apa tu, sir?
Macam mana? Tak, kita kena control dia punya apa. Sebab kita ada dua kan. Kalau kita nak dapat
apa, sir?
Kalau kita nak dapat risk rating, for example in chemical exposure, when you talking about risk rating, you are talking about the hazard rating and also exposure rating. Faham? Remember that our
exposure rating.
Yeah. So the exposure is talking about the frequent apa? Frequently used.
Frequently.
Okay. Yeah. Kita talking juga about the magnitude. Magnitude maknanya darjah keberserapan lah dengan these chemicals. Okay. Magnitude, frequency and also dura apa?
Duration.
Pandai. That show that you are so clever. It's just you don't take that one and then apply it in your oxyplatin. I hope that you can make some repair lah on that. Okay, Faiz? Faham So far so good, Tanya, because you try your best.
Okay, thank you, sir.
And then just try to improve a little bit lah. Okay, I give to my friend over there, Puan Azlina. Silakan, Puan.
Assalamualaikum. Sorry, Cik Aizat, ada interaction line over here. Mr. Faiz, can you hear me? Mr. Faiz, can you hear me?
I can, sir. I can, Puan.
Okay,
yes,
Alhamdulillah.
I can.
Congratulations, a good presentation, a smooth one. Just like certain things that I think you need to be change or penambahbaikan yang lebih baik untuk selepas ini. Can you open me your SDS punya slide? Can I see your second part regarding the hazardous investigation? Sorry. Can I see your pictogram? Sebab rasanya tadi saya tak perasan ada sebarang pictogram pada SDS awak. Can you open me the slide? The SDS slide.
Okay, dah Puan.
Bahagian kedua. Dah buka? Okay. The second part which you need to explain regarding the label, the pictogram. Ingat lagi tak pictogram? Dr. Faiz? Faiz?
Yang ni ke Puan? Yes, saya.
Masih ingat tentang kita belajar tentang tata cara amalan bahan kimia 2013, ada banyak label, pictogram? Faiz?
Ingat Puan.
Hazard identification, I don't see any level over there. Should be a level kan? Ada requirement under SDS for the hazardous identification. Kena ada level kan?
Ya, betul
Yang
puan.
menunjukkan. So I don't see any pictogram, any level over there. So what
Yes,
happened,
macam
Faiz?
health hazard macam gitu, carcinogen, mutagenicity.
Dia merengsa ke, dia menghakis ke, dia chemical atau toxic, gambar tengkorak kan, skal.
Yes.
Ingat tak? Dalam
Ingat puan.
tata amalan chemical 2013 ada kan? Label-label tu, pictogram tu. So
dalam
please.
Dalam slide saya tak letak.
There. Sebab requirement for the SDS 1 sehingga 16 supposedly you kena letakkan macam kita dah belajar dalam kelas. So please do some correction regarding your SDS.
Betul.
Okay. And then make sure that the latest SDS, okay? Latest SDS background warna? Ingat tak lagi? Warna apa? Warna putih. Okay? Yes, warna putih. The border should be the red colour. Okay? So tolong semak balik tuan.
Yes. Okay puan.
And then regarding your poster macam Cik Aizat dah sentuh tadi, juga saya bersetuju bahawasanya dia nampak sedikit unclear over there. Okay? Sebab you pilih pasal ada 3 hazard kat situ kan tadi? Faiz? Boleh dengar saya tak? Boleh dengar saya?
Ya puan.
Boleh dengar?
Ya saya. Boleh tapi
Okay.
sangkut-sangkut.
Sangkut?
Boleh puan.
Saya dengar sangkut. Okay, macam ni Faiz. Cuma bahagian poster. Okay, kat bahagian poster tolong buat penambahbaikan dari segi picture yang suitable dengan your hazardous so that bila orang tengok your poster walaupun tak baca, so orang faham apa yang cuba you sampaikan. Okay? Sebab poster ni kadang-kadang bukan hanya untuk orang yang dalam bidang tersebut. Dan orang yang bukan dalam bidang, kalau dia tengok gambar, so dia lagi faham kan berbanding dia baca. Mungkin certain words dekat poster you yang medical term or common system yang dia tak faham, but from the picture of your poster, then dia lagi faham atau dia memahami apa yang cuba you nak sampaikan. Okay? The rest tak ada apa. Cik Aizat dah sentuh. Itu saja. Thank you Cik Aizat. Back to you. Mr. Aizat, back to you. Thank you.
Alright, thank you very much Puan Azlina for her fruitful comment, and also from my friend over there, Puan Mazlina got something to do. Okay, thank you Mr. Muhammad Faiz. So hopefully you can make some adjustment with regard to whatever comment that we already provide to you, the insight and also the condition and all the reorganizing of your output lah. So we will extend the submissions period, and then you can buat a resubmission lah. The due date will also be explained in our LMS. Okay, boleh Mr. Faiz? Thank you very much for your cooperation. Please remain for a while in the studio.
Okay, boleh. Thank you so much.
Yes, don't leave yet. Just wait for a while because we will end the live session and then we will discuss at the back of the studio. Okay, for the students who are live in this video, please proceed and wait for the next link. We are going to continue for the 10th presenter that we continued yesterday. Okay. Thank you.